Hi everyone, this is me Tito. I'm going to continue for the second part of male reproductive systems. As you've seen in the screen, I'm going to give lectures about the diseases of spermatic cord. Okay, uh, I think you already familiar with spermatic cord. Spermatic cord actually consists of ductus deferens, then pampiniform plexus, and also cremaster muscle. Uh, the most common lesions, the most common abnormalities that we can find in the case of spermatic cord disease is this one here. We call it as varicocele. Varicocele actually is a local dilatation of spermatic vein. It means local dilated blood vessels in the spermatic cords. The dilated vessels actually characterized by thrombosis, okay, and these lesions, this thrombosis will interfere the thermoregulation systems. As you know, the thermoregulation systems in the spermatic cords related with blood flow. Therefore, the thrombosis may affect its mechanisms. And varicoceles, okay, this thrombosis will also interfere the circulations of fluids in the spermatic cords. It also will cause what we call as edema, okay, and eventually these varicoceles will lead to lower fertility due to the testicular damage. Okay, testicular damage related with the degenerations of the spermatogenic cells in the uh, seminiferous tubuli. Okay, and then the other cases is torsions of spermatic cord. Okay, sometimes torsions of spermatic cord can occur in undescent testes. For example, in the case of cryptorchidisms. And the most characteristic lesions of spermatic cord torsions is the venous occlusions that leads to infarctions. Okay, so occlusions occurs due to torsions because torsions can make narrowing of the blood vessel lumens and it leads to impairment of blood flow and it related with infarctions. And then the other common cause of spermatic cord diseases is a side effect of castrations. If the castrations not performed in sterile conditions, it makes contaminations likely occurs. And then, of course, it leads to persistent inflammations. Okay, next, this is the images, sorry, this is the pictures of varicoceles. Yeah, we found many cases of varicoceles in multiple species. Of course, the most common one is occurs in dogs, but personally, I also found one of these cases in wild animals. So this is the testis here, and this is the spermatic cord, and you can see here, this is the very obvious dilations of blood vessels, of veins, and it has a irregular surface. And the arrows here pointed the parts of veins that uh, experiencing a thrombosis. Okay, you can see here this is a multinodular forms due to thrombosis, large thrombosis filling the lumens of the vein. Okay, next is about the disease in the accessory glands. Accessory glands in animal can be varied, but in general, accessory glands can be consist of the portions that we call as ampulla, vesicular glands, prostate, and bulbo-urethral glands. For example, here ampulla. Ampulla is really obvious. We can find the ampulla in some species of animals, for example, in bovine, okay, in cattle. Uh, the disease in accessory glands mainly related with inflammations. There are also some tumors. Okay. In ampulla, the most common finding is inflammations. Inflammations due to infections. For example, infections caused by Brucella abortus in cattle, Brucella ovis, okay, in sheep, and also actinobacillosis. This is a bacteria that usually causing granuloma. And disease in the accessory glands, for example, in ampulla, related with ascending infection. It means the ampulla inflammations follow a uh, inflammations in previous ducts. For example, inflammations in epididymis that will leads to ampullitis. Next, the seminal fascicles. Seminal fascicles is quite large in horses, and the inflammations can cause to various agents, but in my experience, it's usually related with bacterial infections. Okay, it can be ascending. Okay, usually for ascending infections, related with testicular inflammations or epididymis inflammations that may spread into the accessory glands. Okay, it can be also descending due to hematogenous infections, and the disease we call it as fascicular adenitis. Okay, and usually it's a chronic inflammations. Okay, and usually if it's chronic inflammations, it's related with interstitial inflammations. Why it's related with interstitial inflammations? Because the infections may originated from the blood vessels. Okay, and then next is prostate. Diseases of prostate is common in dogs. Okay, usually old dogs will develop lesions in the prostates. Lesion in prostate can be a hyperplasia of prostates, enlarged prostates, and it's related also with increased number of cells, or enlarged prostates can be also related with inflammations of prostates. We call it as prostatitis, and also tumor. So in our experience, hyperplasia is the most common findings in prostates, in particular in dogs. Here, this is the vesicular adenitis. Okay, this is a quite rare case. This case found in ram, okay, in the male sheep. You can see there is normal lobulations here, the normal lobulations of vesicular glands, and you can see the whitish part here. This whitish parts, actually this is a fibrous tissue. So because this is a chronic inflammations, uh, thick fibrous tissue will usually found. Next is about prostate. This is a schematic pictures of prostates. Here in the left side here, you can see this is the normal pictures of prostates. Okay, this is the prostate ducts. The prostate ducts will be lined by a epithelial cells and also muscular tissue. Okay, in the case of hyperplastic prostate or prostatic hyperplasia, you can find the epithelial layers become thick. If it's only one layers in the normal epithelia, in the prostatic hyperplasia, it can be multiple layers. 2 layers, maybe more, usually about two until 5 layers can be found in the epithelia of prostates. This is a benign cases. It's not invasive, but the enlarged prostate will make significant pressures and causing a stenosis in the urethra. And then, okay, this is the other cases in prostate. This is the carcinoma. Okay, the malignant tumors in the prostates. And in the case of carcinoma, you can find many layers of glands, and there is a altered growth of glands, and the lesions also can be invasive to the surrounding tissue. Okay, first I'm going to explain about prostatic hyperplasia. This prostatic hyperplasia is really common and related with age, in particular old age. Some literatures mentions it can be happen in dogs more than 5 years old or maybe 7 years old, but in general it's related with uh, age dogs, lesion in age dogs. Okay, it is hormone related. The mechanism is unknown, but it's hormone related, maybe related with testosterone functions. And in the case of hyperplastic prostates, the lesions will lead to urethral stenosis. Okay, so the pressures from the outside of the lumens, the pressures from the prostate, the enlarged prostates, the increased number of prostatic cells will make narrowing of the urethral lumens, because the urethral lumen will get a constant pressures from the outside due to increased number of prostatic cells. Prostatic hyperplasia can be appear as single or multiple cysts. And then histopathologically, this HP means histopathology. The histopathology revealed a hyperplasia of the epithelial cells, and also the hyperplasia not only occur in the epithelial cells but also in the muscular layers. And then some glands will be distended and will be filled with fluid that characterize the presence of cystic appearance. Okay, and then the prostatic hyperplasia is also common following the cases of Sertoli cell tumors. So in Sertoli cell tumor, there will be increased estrogenic substance in the testis, and this estrogenic substance induce hypertrophy of canine prostates. So it is very common in the case of sertoli cell tumors. Dogs will develop a difficulty on urinations. Okay, here prostates of two dogs in different ages. Okay, this is the older dogs here. Okay, this is the uh, vesica urinaria. Okay, the urinary bladder. Okay, the urinary bladders. The older dogs will develop a enlarged prostate. And in the middle of both these prostate lobes, you can find here, this is the urethra. Enlarged prostate will make pressures in this urethra and makes the urethral lumen become narrow due to constant uh, chronic pressures, and it will related with urine with related with impairment in the urine flow, okay, and make some other lesions. For example, there will be difficulty of urinations, or it also can cause some urinary tract diseases. It can be inflammations, or it can also lead to stones, urinary stones. Okay, this is the histopathology of prostate hyperplasia. So, just like I mentioned, the most common characteristic of prostatic hyperplasia is the epithelial layers. Okay, usually for hypoplastic prostates, the layers can be seen here is a multiple layers, two layers for examples, and uh, there will be also hypertrophy occurs. Okay, so in here, this is the cases of prostatic hypertrophy. We can see multiple layers can be seen, although it's not so obvious, but the size of the epithelia will be enlarged. And the enlarged epithelia is characterized by a granular cytoplasms, okay, granular cytoplasms like this. And it can also make projections into the lumens, because these projections occurs due to increased size of epithelial cells. Okay, this is the cut sections of a prostatic hyperplasia. Okay, this is the urethra. Okay, very obvious. You can see here it's really small, right? And this is the hypoplastic part of the prostates. Okay. And in the case of prostate hyperplasia, the lobes of the prostate will be symmetrically enlarged, and we can easily detect the enlargement by palpations. Okay, and even in the case of dogs, uh, we can easily detect the enlargement of prostate by using ultrasonography. Okay, next is the tumors of prostates. In case of prostate tumors, adenoma is not common. The benign tumors is not common, but the common case of prostatic tumor is here, the carcinoma. Clinically, it can be similar to other prostatic uh, enlargements, whether it caused by hypoplasia, okay, or hypertrophy. The clinical signs is just the same. However, the prostatic carcinoma, it can be invasive and can make quite devastating conditions in the patients, in the dogs. So the type of the prostate carcinoma can be characterized by here asymmetric enlargements. Okay, remember that in the case of hyperplastic prostates, there will be a symmetric enlargements between lobes of the prostates, but in prostate carcinoma, there will be asymmetric enlargements. Okay, this is the characteristic lesions. Of course, there will be increased firmness, cystic cavities may occur, and it can be attached with the surrounding structures. This is an invasive tumors. It can be easily attached and also invades the surrounding tissue. And the invasion can cause necrosis in the surrounding tissue. Okay, it can be a periurethral necrosis. It means the necrosis occurs around the urethra, causing also urinary obstructions. And some cases, although it's very rare, can be also the metastasized to other side. So because this is malignant tumors, although it's not common, but metastasis or spreading into distant tissue or distant organs can be happen. So the type of the prostate carcinoma actually is adenocarcinoma. It can be also mixed carcinoma or even squamous cell carcinoma in the prostates. Okay, so if it's adenocarcinoma, it's related with the prostatic glands, and if it's the tumor arise from the epithelial cells, it can be also related with other epithelial cells, for example, epithelial cells of the urethra. As you know, the urethra has a transitional epithelial cells, and those transitional epithelial cells can develop into also transitional cell carcinoma. Okay, and the disease not only from the prostatic gland, but also can be occurs from the transitional cells that usually found in the urethra. Here, this is the cross sections of a prostatic tumors, the prostatic carcinoma. Here you can note about the asymmetric enlargement here. This is the urethra here. You can see this is asymmetric enlargement. Okay, and you can see some yellowish foci here, yellowish part in here. It's related with mineralizations and also necrosis. Okay, here the whitish part here. Okay, and then this is the histopathology of a adenocarcinoma. You can see you cannot find a normal glandular appearance with lumens. There will be uncontrolled growth of epithelial cells in the prostatic tumors, and you can see here in the arrows pointed a mitotic figures. Okay, it's very common to find many mitotic figures in the adenocarcinoma. Okay, the cells, you can see the characteristic of the prostatic tumors, the adenocarcinoma, is you can find here it has a large nuclei. Okay, large nucleus, okay, with eosinophilic cytoplasms, and there is also fair, variations in the size of the nuclei, nuclear size here. Okay, the the nuclear size is varying here. Large, they are large, but there are also some small nuclei. Okay, it means there is size in the nuclear variation in nuclear size actually representing uh, polymorphisms. Okay, nuclear polymorphisms. That's common characteristic of adenocarcinoma in the prostates. Okay, this is the gross image of carcinoma in the prostates of dogs. Here, this is the urinary bladder, and this is the prostate carcinoma. Here, you can find a irregular surface. Okay, and you can find also beside irregular surface there will be asymmetric size, asymmetric enlargements in the prostates with white to gray masses. Here, white to gray masses, this is the tumor masses, and the whitest part may be representing some mineralizations and even necrosis due to tumor invasions. Okay, it's easy to recognize compared with the prostatic hyperplasia. Next is the inflammations of prostates. Inflammations of prostate is prostatitis. Yeah, prostatitis is also commonly found in aged animals. It can be acute or chronic, and also abscess can be formed depending on the cause of the infections. Uh, in in our experience and also based on some literature review, the Brucella species, the bacteria from the Brucella species is the common cause of prostatitis in animals. In dogs, Brucella canis, the most common cause. Okay, but some other bacteria, for example, E. coli or Proteus, usually it's related with urinary tract inflammations. For example, inflammation in the urethra or urinary bladders can spread into the surrounding tissue, including prostates. Okay, and usually if it's occur first in the urinary tracts, the cause can be different. Usually it's caused by E. coli or Proteus. But if it's related with, if the prostatitis is related with inflammations in the reproductive tracts, for example, in testes or epididymis, usually caused by Brucella canis. So there will be variations in the lesions. Okay, and we can find, for example, scatteral to purulent inflammations depending on the cause of infections. In the case of E. coli, Proteus, we can or Staphylococcus, it's very common to find a purulent inflammations. In cases of Brucella canis, usually we can find catral or fibrinous inflammations. Okay, and prostatitis can be chronic. In the chronic stage of prostatitis, we can find also many fibrous tissue. Okay, this is the urinary bladder, and this is the enlarged prostate due to prostatitis. Okay. In the case of acute prostatitis, there will be irregular surface. The prostate will be enlarged with edema. So you can find in the cut sections, there will be a moist surface here. Okay, due to presence of edema, there will be many fluids in the tissue. Therefore, when we cut the prostates in the cross sections, will be wet due to edema, due to fluid accumulations. Okay, histopathologically, it's easy to recognize in the case of prostate inflammations. Here, this is the prostatic glands, and this is the interstitial tissue. The interstitial part will be expand due to infiltrates of leukocytes. Okay, leukocyte infiltrations in the interstitial part. Okay, and in the case of chronic inflammations, chronic prostatitis, you can find also uh, fibrous tissue in the interstitial part. There will be thick fibrous tissue in the interstitial part, and the inflammatory cells in case of chronic prostatitis usually composed of lymphocytes and plasma cells, and also some macrophages. Okay, this is the common findings in the chronic prostatitis. Many inflammatory cells composed of lymphocytes or plasma cells and some macrophages, and also thick fibrous tissue, just like this one here. Okay, next is the disease of penis and prepuce, prepuciums. The disease, the lesions that can be found in the penis and prepuciums, it can be a developmental abnormality. For example, persistent frenulum. Okay, I will explain about this later. Hypoplasia, it means the penis and the prepucium is not well developed. And also directional deviations of penis, for example, due to broken, due to some abnormalities in the fibrous tissue, or absence of sigmoid flexors. This is can be found only in the bovine, the cattle, or hypospadia, opening of the urethral canal on the ventral surface of the penis. So the opening of the urethra is abnormal. It can be on the ventral side of the penis, or epispadia. Epispadia is different. Epispadia, the opening of the urethral canal will be on the dorsal surface. Dorsal surface will be in the upper sides. Here, this is the persistent frenulum. Okay, this is the penis of a bull. Okay, here, this is the persistent frenulum. It makes abnormal deviations, okay, of the penis. It makes the copulations would be impossible. And then other disease of penis and prepuciums is can be due to trauma. Hemorrhages and hematoma can occur in the penis due to varying cause of trauma or due to mating injury. And tumors sometimes can be found in the penis. For example, the TVT. T means transmissible, V is venereal, T is tumor. Transmissible venereal tumors that quite common in dogs. Okay, in dogs, it can be seen in the penis and also prepuce, prepucium, and also in some cases, this tumor can be seen also in the nose, in the nasal part. Okay, usually it's related with behavior during mating in dogs. Okay, maybe you already heard about the flamen behavior in dogs during mating. Okay, so the male dog will sniffing into the female vulva, and if the tumors occurs in the vulva of female dogs, the tumor will be easily spread into the uh, nasal part of the male dog during the sniffing, during the pre-mating activity. Okay. Uh, the other tumors that can be found is the squamous cell carcinoma. Okay, squamous cell carcinoma originated from the epidermal layers from the uh, from the okay, squamous cell carcinoma originated from the squamous layers. Okay, uh, in the penis. As you know that the external surface of penis composed of epidermis and tumors can arise from there. And also papilloma. Okay, this is the benign tumors in the squamous epithelia. Okay, this papilloma can be related also with some viral diseases. Okay, we can see further here. This is some pictures, but on the penile lesions. First, this is the penile hematoma. This is due to mating injury. Okay, you can find hemorrhages around the penis, in particular around the sigmoid flexors. This is the sigmoid flexors of bull penis, here. And these ruptures usually occurs due to uh, some mating injury, intromissions. There is some disturbance in the intromissions of penis into the vulva, and it causes trauma, and the trauma causing hemorrhages like this. Here, this is also penile hematoma, can cause also extreme necrosis in the surface of penis. Okay, in the bull, usually this caused by forced deviations. It caused by extreme strength during the penis intromission into the vulva. Okay, sometimes it happens in bull. Okay, usually related with bull, which has which is large. Okay, and the other uh, examples of disease in penis and prepucium, it can be also inflammations. Okay, you can see here some examples. Inflammations in the penis, we call it as phlebitis. If inflammation occurs in the tip of penis or in the glands penis, we call it as balanitis. If the inflammations only occurs in the prepuce or prepucium, we call it fasciitis. But usually it's always combined. Okay, so these inflammations can occur not in only particular place, but also can spread into the surrounding tissue. So the cases of balanopostitis, okay, inflammations in the glands penis and prepuce is really common. Or phallopostitis, inflammations in the penis and glands penis. This is also common. So single inflammation, for example, only in penis or only in glands penis is very rare. Usually combinations between tissue. Okay, and then there is also phimosis. Phimosis, it means there is blockage of preputial orifice. Okay, the preputial orifice can be blocked because there is swelling, because there's enlargements of the prepuciums due to uh, inflammations, due to infections that causing inflammations. Usually causing by bacterial inflammation, some cases also by virus inflammation. Usually for phimosis, the bacteria that cause phimosis can be vary. It can be multiple species, multiple type of bacteria. For example, can be Staphylococcus or E. coli, also Corynebacterium like this, and some virus, for example, herpes virus causing the uh, a fasciitis causing the prepucium inflammations, and the infections can spread to surrounding tissue. Okay, and then the smegma, the secretions of the prepucium, we call it the smegma. It is waxy. Okay, it contains fat, and this is favorable for bacterial growth. Okay, and in this case, bacterial infections will likely to occur. Here, this is the inflammations in the penis, okay, and also glands penis. We call it the phalloposteitis. This is the irregular surface due to formations of many small fascicles. Okay, and these small fascicles actually composed of inflammations in the epithelial surface of penis, okay, due to herpes infections. Okay, there will be also hyperemia, okay, due to edema and acute inflammations here. Okay, and these small fascicles can be ruptured and leaving a ulcerative lesions. Okay, so if it's ulcerative, in the case of pyeloposteitis by herpes virus infections, there will be wounded area like this here. Okay. Yeah, this is the papilloma in the penis. Okay, papilloma in the glands penis. There is a quite uh, mass here, large mass with a very irregular surface. Okay, irregular surface, and it has what we call as exophytic papillary mass. Okay, and histopathologically, we will find a uh, proliferations of the squamous epitheliums that's really thick here, the squamous epithelium, this is really thick, and also abundant connective tissue with some inflammations. And this squamous epithelia in the case of papilloma will make a projections, will make a deep penetration into the deep layers of the dermis, okay, deep layers of the connective tissue. Okay, next is common tumors also in dogs. You will find this case during the practice. This is case of transmissible venereal tumors in dogs. This is a unique tumors because TVT or transmissible venereal tumors is a unique tumors that can easily spread to other dogs by just touching. So uh, cases of TVT related with copulations, okay, related with mating, and these tumors easily spread by touching only between dogs. Okay, because these tumors usually occurs in the reproductive system, both in male and female, in particular for female in the vulva, and male usually occurs in the penis and prepuciums. Okay, this is multinodular tumors here, multinodular tumors. Okay, and if we see in histopathology, the tumor size is quite large. The tumor cells are round. Okay, here the tumor cells are round uh, with a we can find the borders between tumor is not distinct. Okay, and there is also fibrous tissue between the tumors like this, and it is very common for us to find a mitotic figures. Okay, mitosis are frequent here, and the size of the tumor nucleus is almost similar with the size of the cytoplasma. Okay, it's really large tumors, and this is a malignant tumors. Okay, sometimes it can also penetrate the surrounding tissue. Next is the other tumors that arise from the epithelial cells of penis and prepuciums. Yeah, epithelial cells of penis and prepucium is a squamous epithelia. It's just the same with epidermis. And because this is a squamous epithelia, the epithelia can also develop into squamous epithelial tumors. For example, this squamous cell carcinoma, a malignant type of squamous epithelial tumors. And in case of squamous cell carcinoma, we can find the keratin pores. This is the characteristic of squamous carcinoma. Okay, is the presence of these keratin pores. Okay, keratin pores surrounded by the tumor cells. Okay, and it is also common for us to find the mitosis here. Mitosis. This is also mitosis, and also this one. This is also mitosis. Okay. Yeah. As you can see here, the tumors are invasive. Why it's invasive? Because it can cause also hemorrhages. Why? Because it can penetrate and invade the surrounding blood vessels. So this reddish color here related with actually hemorrhages, and the surface can be uh, ulcerated like this here. There is open wound indicating ulcerations. Usually this is occurs due to tumor invasion into the surface, into the surrounding tissue. Okay, that's all for the second part of my lectures. I'm looking forward for your questions. Okay, thank you.